Hi, my name is Mohammed Rampak. This is Anatomy and Physiology Lab 2, Video 4 for blood vessels. In this video, I'm going to represent my learnings from the blood vessels and arteries in this chapter. So, I want to start with one clear-cut images from the upper arteries, like from the heart up to the head. We can see in the middle, and this is the aortic arc, and its three branches, which is in the middle is left common carotid artery, and to this left side it's left subclavian artery, and to the right side is brachiocephalic artery, and then right common artery is branched from the brachiocephalic artery and goes up all the way to the head. And in bifurcation, it is split common carotid arteries split into external, which is here, and internals up to circumvallus. So, and regarding the aortic arc, and this is the aortic arc. As we see, um, this is the brachiocephalic artery, and this one is left common artery, and this is left subclavian artery. And regarding the heart and also inside the heart, and we can see this, it's very clear, and we can see the descending, and this is the aortic arc. We can see it. Behind that, we can see the superior vena cava, and we can see right pulmonary artery, and then right pulmonary vein. You can see two veins in right pulmonary veins. It's very clear. And also regarding the internal and external jugular vein, and external jugular vein is very anterior part of the neck. It branches from the cephalic vein, and external and is up almost posterior to it, is behind the neck, and you can see in this image more proper, but this one is not uh, colorful, but we can see the external jugular the most. This is much thicker and goes up all the way to the head, and then behind that we can see the external jugular goes all the way to the head. And this is all about um, the arteries and vessels in the upper part. And the most common disease within the arteries and the vessel system these days is atherosclerosis, which means the hardening of the arteries. So, in some mild scenario, the treatment would be kind of medication, but in worsened scenario, but in most cases these days, the invasive procedure is almost recommended, like arterioplasty or enterectomy. Enterectomy is the easiest way to clean up the blockage in the arteries, especially the common carotid arteries, and they open the arteries and then clean up the blockage area. Yeah, it's called cleansing. And also in some scenario they do a kind of graft or artificial graft with that can be seen here. This is the disease or pathologic things, and this part is removed and replaced with the new graft, a new kind of duct, and it's pretty nice technology these days that can all surgeon do. And this was all of my learnings and the brief learning of this chapter.